Thank you very much. Dr. Vandewater.
Mr. Chairman, Mr. Miller, and members of the committee, I appreciate the invitation to appear before you today. My testimony draws on a letter that I and over 250 other economists recently submitted to the committee. The Affordable Care Act will significantly strengthen our nation's economy over the long haul. The law takes essential steps to slow the growth of health care costs, which are consuming an ever-increasing share of our economic output and have contributed to the stagnation in workers' real wages. The Congressional Budget Office estimates that health reform will slightly reduce premiums for employer-sponsored health insurance in the near term. For employers with more than 50 workers, who account for 70% of the total insurance market, CBO estimates that the law will reduce average premiums by up to 3% in 2016. Small businesses will pay less for a given package of benefits. Qualified small businesses are also eligible for federal tax credits for their health insurance contributions. Even if health reform were to impose some costs on employers, economic principles strongly suggest that the impact on business hiring decisions would be small. Because the major impact of health reform does not begin until 2014, businesses will have time to adjust, increasing the likelihood that any impact will be primarily on workers' after-tax compensation, not on hiring. And in the following years, as health reform begins to slow the growth of health care costs, workers will see larger increases in their take-home pay. All in all, the short-term economic effects of health reform will be quite small. One major financial research firm terms the law's economic impact minor and says that any disincentives from higher taxes and fees will hardly make a difference. CBO foresees a small net reduction in labor supply because some people who now work mainly because they need to obtain health insurance will choose to retire earlier or work somewhat less, not because employers will eliminate jobs. Over the long haul, health reform will have many positive effects on the economy. First, CBO estimates that health reform will reduce the budget deficit, modestly in the first decade, but substantially thereafter. The lower budget deficit stemming from health reform will hold down interest rates, free up more capital for private investment, and boost long-term economic growth. Second, health reform will increase labor market flexibility. The new law will reduce job lock when workers stay in a job just because they are afraid of losing their health insurance. As a result, Americans will be more able to switch jobs and open new businesses. The result will be a more productive economy. Third, expanding health coverage to 32 million uninsured people will improve health outcomes by helping people obtain preventive and other health services and improving continuity of care. This, too, will enhance economic productivity. Finally, and most important, the Affordable Care Act contains almost every cost containment provision that policy analysts have considered effective in reducing the growth of medical spending. These include payment innovations that will reward providers based on the value of their care and not on the volume of their procedures, an excise tax on high-cost insurance plans, an independent payment advisory board, the Center for Medicare and Medicaid Innovation, measures to inform patients and payers about the quality of healthcare providers, more funding for comparative effectiveness research, and steps to promote wellness and prevention. Slowing the growth of healthcare costs is one of our nation's most pressing economic challenges, and success will benefit employers, workers, and taxpayers. The effort will require an ongoing process of testing, experimentation, and rapid implementation of what is found to work. Health reform begins that vital process. Thank you very much.